So, welcome to the College of Public Health and Human Sciences Research Seminar. I'm Marie Harvey, Associate Dean, and I'm delighted we have people here in the room. Thank you all for coming. We have people coming into the chat room there in the Zoom, so thank you all for coming online. John will tell you more about asking questions when you're online, so I'll just let him do that. So let us get started. And it is my pleasure to introduce John Geldof, who is an associate professor in the program in Human Development and Family Sciences. And for you to know that this seminar is being co-sponsored and hosted by the HDFS program. So John will do the introduction of the speakers, and he's going to moderate the Q&A. Take it away, John.
Thank you, Marie. Well, maybe I'm going to fall over. All right. Thank you all for being here. So I'm super happy to have this opportunity to introduce Drs. Kelly Chandler and Doris Cancel Terrado, who will be speaking today. Dr. Chandler is an associate professor in our college's very own HDFS program, and she applies a work-family justice lens to study how working conditions, workplace culture, and family policies affect the health and daily lives of employees and their families. Dr. Cancel Terrado is an associate professor who graduated from HDFS, but is now at the Division of Health and Physical Education at Western Oregon University. Doris has over 20 years of experience working with health and human services agencies. She engages in multidisciplinary efforts to improve family health and well-being in diverse and multicultural contexts. Today, Drs. Chandler and Cancel Terrado will be discussing the Rural Family Speak About Resilience project, and especially focusing on how their interdisciplinary fusion of HDFS and public health led to something bigger and better than either one of the two disciplines could have provided on its own. And because HDFS and public health are so closely fused in our college, we really hope that this serves as an exemplar for what other folks can be doing and really reaching across boundaries to make our college even better than it already is. With that, I'll hand it off to...
Can we test without here? Did those people hear me? I'm over here. Right. I'm here. Yeah. Oh, wait. I want to use that. All right. Well, thank you all for coming, and thank you, John, for a polite introduction. I wasn't sure what I'm gonna get. We have a very polite floor, so I would have. But yeah, when John asked if I would be willing to do the research seminar, at first I thought, okay, I'll share my research. That's really focused on work, intersecting with family health, which is very exciting research. But then I thought, why not take the opportunity to talk about Rural Family Speak About Resilience, which is moving into this new way in this data collection, to capitalize on the experience and expertise within the college, and something that I've really been thinking about since I came to our college in 2015. What really drew me to it was that HDFS is within the College of Public Health and Human Sciences, and really wanting to see those really strong connections. So I thought this could be an opportunity for Doris, my friend and colleague, who actually has both that fusion of family science and public health, to talk about sort of our learning process and how we brought these two disciplines together to our research. Carol? Hand it over to.
Well, thank you, everyone. Thank you for such a kind introduction and the opportunity to be here. This is a place that means a lot to me, and it's always great to be back home. In some ways, it's home, right? When Kelly pitched me the idea to do this presentation, I was very enthusiastic. Yes, and then I'm like, why? I don't need so much work, but that's a big why. And I think besides that, I adore Katie, and she and I work all the time together, and it's always fun. It's because this is my identity.
I was in the college when the transition process when we were QC, and through the encourage, Mary Harvey encouraged me to pursue my MPH after I was almost going to complete my HDSA. Why? But I would think it was great, and I think it's because I think that way, and I invite you to speak about this as being bicultural. Like in the same way that I can be a loud fun Puerto Rican, I can also be a serious, something boring American professor. I like kind of navigate both. So I see this approach as family science and public health the same way, right? And what I try to do is that I try to get the best of them, mix them together, and come with something great. Sometimes it's work, it's like cooking, sometimes it doesn't, but it's always fun. So, Ken, back to you. So here's just a rough outline. We want to start by just providing a very brief history of the Rural Family Speak Project, which this is a group of collaborators for over 20 years that we were both fortunate to join, because that provides a little bit of context of the next wave of the Rural Family Speak About Resilience Project. But we really want to focus our discussion about how we began this family science public health collaboration, and also what we've sort of learned by doing and what we hope to do as we move forward in this next phase, and how to use the Rural Family Speak About Resilience Project as an example of that. So super brief history. Need to recognize the funding through NIFA, so it's an ag experiment station. I know there are many faculty in the college that also participate in these multi-state hatch projects, so I want to make sure that I recognize that. But yes, I'm grateful for the funding to support annual meetings with our multi-state collaborators and some research support that makes it happen. So the underlying motivations for the Rural Family Speak project are three broad ones. So obviously to increase research on an understudied vulnerable population. So this study began by looking at one of the most vulnerable populations, rural low-income women in rural areas and their children. The other motivation, being a land-grant university and this being part of NIFA, is to translate this research to practice through extension, webinars, information, and so forth. And also to lift the voices to policymakers about ways to enact change that is more inclusive in the policies and equitable. And this is a little blurry. This is the old school image for the project, but I like it because it just really kind of nostalgic about this project. Don't look at the spacing, John. So the project has a lot of history, and a lot of the project history is tied to OSU. The project originated in 1998, and the project was a response to the implementation of the welfare reform in 1996. Back in the day, our dear Leslie Richards was working here, and she was one of the regional members who started the project. And the idea with this project was to explore how families have adapted to the policy and the economic changes to achieve self-sufficiency. Self-sufficiency was one of the big tenets in this change of policy, and how this going to look like in rural communities where there's so many challenges, right? And then to analyze what were the interactions among public assistance and informal social support, community context, and individual family characteristics, and their relation to the well-being of rural low-income families. This was a huge project back in the day, and I feel very innovative in the sense that they were really trying to look in real time what was happening to these families at the same time that we're implementing the policy. And the way this worked, the project has to be renewed every 5 years. So there was two ways of data collection for the Rural Family Speak. The first one was the quantitative data collection. The second one was qualitative. That actually was housed and analyzed here at OSU on the Leslie Richards Research Lab. Then in 2008, the Rural Family Speak About Health project
began. And this was also a response originally to the healthcare needs and the health challenges faced by these communities, but then by the implementation of the Affordable Healthcare Act in 2010. So the project has this history of a reaction to policies and trends affecting rural communities. This also had two ways of data collection, quantitative and qualitative. And the project ended having a very strong emphasis on the impact of the Affordable Health Care Act. And then we have our new version, right? Is the Rural Family Speak Resiliency. This is where Kelly and I, in these two projects, we work as collaborators. So we're not true PIs. We didn't collect the data, but we have access to it. In this stage, Kelly and I actually were like the ones who wrote the renewal and developed the framework for the project. And in this case, we're looking, and what drove this idea was that many of these communities were facing natural disasters. Think about hurricanes and fires. And one of our big concerns were like, well, this is going to look so different, like in great communities, but then COVID happened and it brought an equal challenge for all these communities to study resiliency. Okay. As you can imagine, a project of this history has tons of impact. And one of the main impacts from my point of view is that when the Rural Family Speak project began, they were very intentional about recruiting diverse families. They have a large subset of Latinx families recruited, African American families. And back then, 20 years ago, you didn't see a lot of representation of these families in the literature talking about rural communities. So from my point of view, that's being one of the larger impacts. They also have a big emphasis on outreach and the production of applied research that can serve extension specialists. We have a lot of extension specialists in our team. This project has produced many tenure and promoted faculty members like Kelly and myself, and many students. I was a student in the project, and now I'm a faculty member. I think there's like 5 of us who were students and now we're faculty members collaborating in the project. And of course, then student training and the access to resources. I just want to highlight that there's several students in the program that have been in your program that has benefit from it, include both graduates and undergraduates.
And it was really small. So we don't have time to go into the wealth of research that the team has collected over these 20 years. Maybe that's for another presentation, depending on how this goes. But just to sort of build on with the faculty advancement and the student training, this is a really generous group. It was a little intimidating going in with the people that have been working together for so many years. But they really are collaborative and generative and really have that mission of really wanting to understand and support rural low-income families. So I'm grateful to have been a part of the first paper looking at income security. There was a paper on food insecurity, understanding family well-being in a context of poverty, health challenges and health disparities. And then Doris led a paper on the risk and resilience of Latinx. So it was nice that the Family Science Review had a special issue to really showcase all the work that's been done. So this is just an example of some of the output in the scholarship contributing to the knowledge there. The other output is outreach, right? That is a big part of this project. And Dr. Brianna Rouse from Montana has organized this relying on rural resilience, and basically taking the research that's already been done and really finding those examples of resilience that have already, been described to us and showcasing that. And so these webinars that we've had basically cover a number of different topics using the research, like I said, but inviting like extension specialists and other outreach folks working with families to share this research and then think about how can they use this research in their communities. But it's not just about, giving to them, but also they can give to each other. What works in their community? What hasn't worked so well? And, it's a learning experience for us as well, too, to really try to engage about what are the best practices or alternatives, or just the possibilities of outreach and support.
So how this collaboration began and the idea behind the family science public health framework? Well, serendipity. There was not any intention, and back in 2014, right after I have a baby, again, I chose this very bad time, to start a new project. But Dr. Joshia Sano, a former student that now at Brianna, the one that she mentioned, was also a former student, now a faculty member. I bring this often because I feel that this is a beauty there's a beauty in the project. Invited me because they already have run the Rural Health Act, the rural families speak about health. And when she found out that I have a master in public health, that I was teaching public, in a public health program, she's like, "Oh, you might be great to join the group." So she invited me. I started thinking more about how to integrate public health to the framework. I got a Robert Williams Foundation grant based on the idea of putting together county health rankings data with the data that we have collected in the family, speak about health. Then Kelly joined us 2016, correct? And she and I became the Oregon PIs. Back then I was working with the Washington team, and we started collaborating more. And the team was struggling because they were trying to move more towards public health. Other faculty are in the same situation with the HDFS program in public health schools, right? Trying to adopt the framework. But sometimes the way they collected the data not necessarily led, to the outcomes that they were hoping, right? So that's when we start thinking about, okay, for the next renewal, if we're going to renew, because that was another conversation, right? How can we integrate more context-based knowledge and community-based? And what Chandler and I are presenting today this is brewing ideas. We're inviting us to help us brew these ideas, right? Because it's been a iteration process of thinking and going back and forth. And when we put the renewal together, I think that even when we put the renewal together, we're not intentional. Again, this is happening more organically. And now we're thinking about, we should be more intentional. So the idea with this presentation is that, make the same mistake and we can be more intentional about the framework that we're doing. So it was, again, very organic and serendipity, but now we want to make it more formal and be more purposeful about what we do.
And just to be reminiscent of our, late nights, typing this renewal is definitely a bonding experience for Sam professionally. And I'm glad that we're continuing to ask this. Okay. So just to provide a foundation for some folks that may not know what family science is, so I'm focusing obviously on the FS of the HDFS. Family science in its name is a relatively new discipline. Of course, there's been research on families, but the name family science and the National Council on Family Relations is really the leading or professional organization for family scientists and practitioners. And so really trying to, highlight this discipline and this identity. And so in its essence, family science is the study of families and close, intimate relationships that are characterized by 5 things. Obviously, relationship focused, but trying to understand healthy family relationships across the lifespan, using evidence-based practices to support families and couples, be really strengths-oriented. So especially with this project, which we'll highlight a little bit more, is not taking a deficit approach of all the, challenges and things that people are experiencing, obviously recognizing that, but what are the supports, the strengths that they already have, and how can those be built upon? A preventative approach and also translation, which we show next. So, family has been called the forgotten link in public health. And it's interesting because health begins at home, right? So, the family is one of the most influential contexts or relationships for health and development. And it's important to recognize that the family is a system, and all the family members influence one another, right? They're interdependent. So one family member's health or health behaviors influence the others. And a family is more than the sum of all parts, right? So just understanding maternal health or child health doesn't really give us the full picture of family health. And so this family systems perspective, I think, can be really useful in combining it with a more public health model approach. So I just want to make sure that I'm clear because there's a lot of research that's about families, and Doris will elaborate on this, but talking more about the whole family system, the whole family unit, not just parent-child diet. So just a recent review of public health models looking at how family is depicted or what those processes are as family as a health promotion context. And he looked at over 100 different models. And basically across those models, there's very little consensus about what are those processes in families that promote health, right? And so it seems like, at least for me, an obvious thing about looking at how family processes support health, but it's also very complicated, and I recognize that too. And another important point is that for those that are family scientists or even in your personal life, is that there's really this lack of recognition of children as being active agents in the production of family health too. So that really goes back to that family systems approach of looking at how everybody in the family influences one another for their function.
So I'm going to talk now about public health and try to link to some of the ideas that Katie had brought, right? So, when we think, again, because I'm bicultural in this conversation of family science, public health, sometimes I see that it feels like constants. They have a lot of shared experience, but then the unique quirks, right? So if you think about public health, right, we are population-based, right? That's, where we're grounded, prevention and policy-oriented, evidence-based. We have a health equity goal, right? And if you think about it, right, these are shared, right? These are common areas shared with family science. Family science, she mentioned it, prevention focus, right? Evidence-based focus, right? But when we think about the social determinants of health, right, you may think, okay, so then we can see the family here and the social and community context. Yes, and the family fit there. But the family also plays very unique aspects to health. When you think about family, families often move to different communities and different contexts, and those are going to be carried, right? So when you look at the impact, then we can start thinking and seeing the family as a social determinants of health. And I think we all can agree, and this family science and public health, studying family as a unit, being your unit of study, is complicated and it's challenging. And I think that that's one of the reasons we don't include it that much, because there's challenges, but this is where there's an opportunity. And this is where I think, given the arrangement that you have here in this college, you have a unique opportunity, right, to change that. How can we integrate family as a unit of study, and how we do this in a way that we see family as a social determinant of health, and it's a study as such, right? So she mentioned it. Health is produced in the context of families and relationships. And actually, there's a framework that I wish both family science and public health use more, and it's the household production of health. And this framework comes from microeconomics, and it looks at how families manage resources related to health, right? And when they think about the production of health, this is how the authors, Burhan and all, describe it. And I quote, "It's a dynamic behavioral process through which households combine their internal knowledge, resources, and behavioral norms and patterns with available," and here's where you bring the social determinants of health, "available external technologies, services, information, and skills to restore, maintain, and promote the health of their members," end quote, right? So the family is serving as the mechanism in which social determinants of health compete, influence, affect health in this context, right? So then family can be seen as a source of risk or as a source of protective factors, right? But I want to be cautious. And this is something that I want to read both for family science and for public health. Family structure is not the same that family functioning. We need to understand both and how they influence health, right? When we say married couples are more likely to live longer, what are the mechanisms that cause that health outcome? Is that true if you hate your partner and you beat all you with them on the night? Right? Or is this true, right? And nuclear family is not the family. And this is a problem in both fields. We continue to look at family from a nuclear standpoint, where less and less children are living in nuclear families. And for example, when we think about COVID and the impact of COVID in children, many people talk about the parent loss, but people are not talking about grandparents. I live in a multi-generational household. COVID affects us differently because we have a grandmother living in the house, right? So how we integrate that in this model. And the other piece is that health policy is family policy and family policy is health policy. Just think about the example of health insurance. When you have you access health insurance, it's often through what we have determined to that family policy. Who is married? Who are your who is considered your child or not, right? What kind of family structure do we recognize and get access insurance through one of their members? That is one simple example. But if you think about policies about sexual and reproductive health, policies about death and dying, they are health and they are family related, right? So they are very integrated. And I think that we're doing a disservice to both fields when we don't understand family as a social determinant of health. And I'm passionate about it, you can tell, right? Jesus, I'm like, how do I match that? So, with families being a social determinant of health, really trying to figure out what are ways that, family scientists or public health practitioners can foster and support family functioning that's conducive to health. And so Hansen and colleagues proposed 4 guiding principles to guide basically the efforts of practitioners with families, at essentially blending family science and public health. So I'll just quickly go through them. So the first is that family engagement. So that's basically involving families in all stages, having them involved, listening to them. What are the things that they need? And a key point here too is providing services for the entire family unit, right? And so that's a huge thing that I want to emphasize here, looking about that family system. Family responsibility, right? So empowering families to make decisions, support and respect those decisions, and come up with strategies that work for them in terms of their health promotion and production. Recognizing family stability and how family functioning and health intersect over time, those influences over time. And then finally, family diversity. So just to build on what Doris was saying, really recognizing and being thoughtful about how different programs and practices and policies can influence or have different effects on families with different backgrounds and experiences. And so for this last guiding principle, cultural attunement is critical to be able to promote health in a diverse
group of family.
Just like this.
um, so now we're going to transition to Rural Family Speak About Resilience. So kind of giving you that background of what this project is, how it started, and bringing this family science and public health together. And as Doris said, it wasn't necessarily intentional as we wrote this proposal, but we do see manifestations of that we wanted to share as sort of like an exemplar, and then talk about what we have seen, our perspective in terms of benefits, and how we hope to move forward, and then open up discussion about that to hear your perspective. So this is how it really resonated with me in thinking about this Rural Family Speak About Resilience project. Many rural low-income families are functioning well, although the mechanisms by which they adapt and cope with the demands of their lives are not well known. And I think this really captures a lot about the project, is that it's strength-based approach, right? And again, recognizing, not just focusing on the deficit approach, but recognizing that families are thriving, they're adapting, they're coping. But we need to understand what those mechanisms are to be able to have a really effective program or policy or intervention to support families. And so that was kind of an underlying motivation for this project. And so for this project, we had two main objectives, and you see in terms of focusing on community and the other focusing on individual and family. So the first objective is to assess community capacity to support resilience in rural low-income families, which Doris will talk about in a minute. And then the second one, which I'll talk about, is really trying to understand these resilience processes at the individual and family level. So I want to make sure that we recognize our team, our collaborators. So I have stars representing the states. Most of them are from land-grant universities, but we have those that aren't in land-grant universities and collaborating with us. And you can see we're spread across the U.S. And so really trying to understand experiences in different communities, different states. But rather than this, looking at this boring picture, here's a picture of our team, most of the team members. In 2019 at our annual meeting, Doris and I hosted the annual meeting at the time, and we're at the Portland building. And these smiles are, I'm going to be really cheesy, but these smiles are genuine. It's really becomes a family, to be honest. Because you think about the generations of training and getting together. So just meeting once a year to plan the next steps is really engaging and has been a lot of fun. And I'm really glad.
This is Joshia Sano. She was the original research assistant for the first project with Langley Richard. So, so many years of work and collaboration.
All right. So, from the inception of the Rural Family Speak project, Bronson-Brenner's bioecological model has really framed this study. And in sort of guiding how we study the experiences and the effects, the factors that influence rural low-income families' lives. Now, for those of you that are taking family theories with me in the spring, this is very simplified and outdated, so we'll learn a lot more about it later. But I did simplify it for a reason, right? And to just acknowledge, like, these were the three factors or levels that we focused on, but recognizing that there are many other levels and culture and things that influence these experiences. But I think this quote is helpful as it relates to this model. In order to inform policy of practice, there's a critical need to understand which system or systems to target, at what levels, and when, to bolster and capitalize on these strengths. So one thing that we were very intentional about when we were writing this proposal, discussing this project, is that we weren't going to basically focus on resilience as a trait, right, which has been done in the past, and move past even resilience as an outcome. That is certainly important. But what is resilience as a process? Really understanding how that unfolds over time to really understand, again, to be able to pinpoint areas to support, engage, intervene. So there, you probably are aware, there are a number of risk and resilience frameworks. And oftentimes when you see these articles, there's a table that lists a bunch of risk and resilience or protective factors at various levels. So here's one example of community, family, individual. So access to quality healthcare, family cohesion, emotion regulation. So these are factors that are shown to be related to adapting or coping. But again, this focuses on the factors and less so about the mechanisms. So we really wanted to make sure that we were asking questions that really gets at those mechanisms. That's really been overlooked in research.
So in terms of the community piece of the project, we wanted to make community the forefront of our project. And if thinking about what Darien in 2008 said, was like, when we think about the socio-ecological model, we're staying too close to the center and not looking at the outer layers. And we wanted to do that. We're going to start with the outer layers. We're going to understand these communities. What are the capacities that they have? So we then move and understand the families interacting in this community, right? So that was a very different approach that what other projects have done. And we integrated a community capacity model that they look not just at financial and social, that's what people tend to move, but also look at natural resources. For example, these communities has a wealth of resources, natural-wise, cultural. Like, what is the culture in these communities that making them survive, the human capital, political, the infrastructure, and have a more comprehensive view of these communities. So this is the framework that we integrated to begin with when we were thinking in terms of the community profiles and the key informants. And here it's where we integrated as much as possible the public health framework. As I mentioned, we were really reaching for the stars, but COVID, because let's tell this kind of humility. We have big plans for the community assessments. We really had to scale down what we were hoping to do, but at the core of it, we wanted to really understand the community and the context of the community before moving forward. So Dr. Patricia Dyke at the University of Kentucky, she then made a collection efforts. They used this two sources of data, the American Community Survey and the Robert Wood Johnson Foundation, to create the profile to understand what are the health outcomes in these communities, what is the demographics, the economic outcomes in these communities. We developed 25 community profiles, and the idea is that these profiles are going to be linked to the key informants, and I'm going to talk briefly about them, and eventually to the family data. And the information collected in the family data is going to be informed from what we have learned about these communities. And then we conducted interviews with community key informant in these 5 sectors, healthcare being one of the main, with the main ones. And right now we are in the data analysis of stage of the project, but I am involved in 2 of them, one of them being food security. And one of the things that we're seeing, for example, in terms of food security and resilience, is that those communities that already have strong networks with school systems did better. And that's not a surprise, right? Than communities that didn't have that those strong networks. So again, we're trying to compare these communities, why one communities were able to weather some of these challenges better than others.
And I just want to recognize Dr. Letta for a while.
Yes.
Thank you, Kansas State.
Yes.
and his team that really led these data collection efforts, which was instrumental in us being able to understand these three. All right. So we're in the very early stages of the family data collection side of things. And given what we talked about today, I'm using family. Essentially, it's interviews with the female primary caregiver in these families. Because of COVID, we ran out of time with our grant period to be able to actually do semi-structured interviews. Instead, with the many limitations that we recognize, we're doing these brief online surveys, recognizing there are going to be selection effects based on broadband issues in rural communities. But we're looking at kind of like a pilot study or exploratory study to kind of get our feet wet to understand resilience. In terms of future data collections, which there's a lot of folks in the college who are working in rural communities across Oregon, so we would love your inputs and discuss potential collaborations. But our future efforts that we've been talking about in Oregon is to actually do semi-structured interviews to really give people the opportunity to talk about the process, right? Hearing these really thick and rich descriptions of, first, what did they feel like was an event or an experience that they felt resilient about, and then what did that look like? And potentially trying to interview all caregivers in the home, right? So the extent possible of getting more of this family system context, the different perspectives and how people work together. So those are our goals. And the grant period for this renewal is up in a year. So gotta get working on that proposal again, Doris.
One thing at a time.
One thing at a time. All right, let's get through this. Maybe and I may have forgotten what.
So as our intention with this is to invite you to think about family science, public health collaboration. I would love to see a framework. I don't have the capacity where I am, but you are a school of public health. You have the resources and the capacity to develop a framework that is strong, and I would love to, as an alum of this program, I would love to see the college becoming a pioneer in this. I have been and I collaborate with the people like in the University of Maryland. They also have a similar structure. They have done similar work. Yet I don't see this strong integration of the model, right? I think there's recognition, and I think family and health separately has something shared. Everyone uses the term family. Everyone uses the term health. But I'm not sure if we actually study families and study health. I was sharing with Kelly that now in Western, every single department has a class that has health attached to it, right? Because the trend. But can we not make it a trend and make a true effort to really study families and health at a deeper level with them, influencing each other, and the college becoming the pioneer in that? I would love that. There's tremendous potential for growth and innovation, and I think this is an area that can, really grow. It has strengthened the marketability of graduates. I think when I apply for grants, this is something that benefits me. Having the public health and family science thesis have been an asset for me. And there's opportunities for funding. Now, RWJF has several grant opportunities, and you have to have and demonstrate true multidisciplinary, right? It cannot be like you're doing health promotion and you're doing epi and work to different fields. You have to demonstrate that. So there's opportunity for there. And I think, so some of the maybe think about creating multidisciplinary research efforts, dual degrees, beyond child and maternal health. You think about Portland State, they have the urban planning, the MPH, so maybe family science MPH. Cross these courses and training between the curriculum, the faculty running opinion pieces about this. And I think this is my humble opinion from a former alum. Integrate the framework in the identity, mission, and vision of the college. So it's very visible for others that is that piece there.
And I just wanted to build on and say,
Sorry.
That's okay. One thing that I've really enjoyed and appreciated is having public health undergraduate and graduate students in my family studies classes, and hearing how they appreciated the perspective of this family systems context. And I'm sure that HDFS students, family scientists, have also benefited from public health. So there are these signs that there is appreciation for the other disciplines, and that we can just continue building that collaboration that will really benefit us all in terms of our research. And so, as Doris said, we really believe that our college can be the leading example of strong family science. Family with an F, not just maternal or child family health, but family health. And so there's a lot of great work I want to acknowledge that's being done in the college. So I hope that we can continue to build on that and really foster these collaborations to reach our vision of lifelong health and well-being for every person, every family, every community in Oregon and beyond. And we would absolutely love to have conversations after this. Thank you.
About 10 minutes for questions. CJ is our webmaster today. He's hanging out right here and field questions online. Actually, okay. Oh, okay. All right. Dr. Glenn Markham asks, hello, Kelly and Doris. Good to hear where this project is going. My questions are, how many community profiles are from Oregon specifically? And what is the level of engagement families will have in what is being asked and or
So in the initial stages, we there will be 2 rural communities in Oregon. And the idea is to, practice what we preach, so to speak, of engaging with families, understanding what are those aspects of their communities that are helping them thrive versus hindering them. And so what I'd like, and I know that Doris would like as well, is, to have these in-depth interviews with them and go back to them and say, this is what we've learned. Is this capturing it? Is there something missing? To really make sure that we're capturing those experiences. And so getting the different perspectives, the communities, key informants about families, and vice versa, to really try to find that holistic picture.
But we haven't collected data in Oregon yet. We are working on coastal communities. And it's been because we've been building those relationships right now. So we expect that some point next year, we're going to be able to do some of the data collection in coastal communities. That's what we want to target.
Yeah, that's a great point. I just want to say, in terms of engagement, so it's not us just, coming into these communities, asking them, how are you resilient? This really sucks if this happened to you. We learn from you. But again, just being a part of the communities, not just to collect data and just take, but to be a part and see, what we can do to contribute to the community. So we want to make sure that we have the resources to invest in that way.
Thank you for the presentation. And I hadn't realized that rural family speak has been going on for so long. Can you describe the structure? Rural family speaks is just a collaboration across the universities where you come up with the same ideas. You have cohorts of families. What's kind of the arching description?
Sure, go ahead.
Well, can you read?
So Veronica's asking a little bit more about the structure. I should have probably spent more time on the ag experiment stations, but basically it's a multi-state collaboration. So groups come together with this common goal, write a proposal about how they're going to collect data. What NIFA funds, correct me if I'm wrong, is essentially having annual meetings where all the states PIs can come together, talk about data collection, work on papers and outreach and that sort of thing. But then finding additional funds to be able to do that research. This project was more focused in the north central region, but it's expanded over time. And I think which has been great and enriching. And so the earlier ways, for lack of a better word, there were different mothers with each project, right? So there's like 444 mothers in Rural Families Speak, and then, or is that Rural Families Speak About Health?
I'm a little fancy. No, little family speak. I don't remember all this, guys. So yeah. Little family speak. So I think that it started with 400. Yeah. There's also Hawaii and California and Washington and Oregon were the states on the West Coast that participate. But each of the different versions have different ways of collecting the data. Sometimes a state, like in this case, Kansas State, took the leadership and they had the resources and collected some of the data for the key community key informants. And Kentucky did the community. For Rural Families Speak Health, I think that there was some grant that the group applied. So each project looks different. And then one group, I think California managed the quantitative, and then Washington, Iowa managed the qualitative data. So it looks different. The whole project has bylaws. So we vote who is, like there's a process of voting and making decisions who have access to data. So if I'm not a collecting state, I'm not granted access to data. I have to work and collaborate with a data collection state. So there's certain protections for members. So it's a very interesting, not your usual research group where you have the grant and everyone wants the same. Another challenge is that you have people that are housing experts and economic development and family and health. So when there's data collection decisions, you want to make sure that the data that you're collecting also speak and serve different researchers. So it's very unique. I would say it's very unique. Does that help a little bit to understand? Yes.
Yeah, and David Rothwell and Stephanie Gretzwalker, they're at other ag experimentation projects, similar things. I'm sure there are a lot more.
Yeah. Like one.
So when you talk about resilience, is it more financial or emotional? Okay, so the question is, when we're talking about resilience, is it financial or emotional? That's a great question. So resilience can mean a lot of different things, right? And so and that's part of it, just trying to understand, like, what is resilience? Like, how do we capture that? And so that's part of the motivation for this study. Typically, when evaluating, like, who has been resilient, they've faced an adversity, and then over time, they are, like, showing more positive indicators on health or emotional well-being or financial well-being and things like that. But really having it to connect it to, was there some type of adversity, and then seeing that person kind of bounce back. It's kind of a silly way to describe resilience. That's a great question. Yeah.
What a life. So Kara McElbay says, how are y'all thinking about the policy implications of this awesome work, given that multi-state design? I can imagine so many interesting ways to roll up your learning, and wonder how that's gone over time and what you're hoping to do in the coming years.
That's a dissertation question. I don't know.
I'm proud of my student, Karen. Thank you for the question. To be honest, just to be fully transparent, obviously I haven't been involved in the project, but I really want to learn more. Being involved in the family policy group with David Rothwell and really trying to figure out how to make really strong connections to policy implications. So understanding the variation of policies in the different states and kind of what those experiences are, so we can learn from other states. And like I said in the beginning is, one of the motivations is to lift the voices to policymakers that aren't otherwise heard. And so for me, this is a learning process about how to do that and make sure that I'm being true to the participants.
So one of the ideas behind integrating community and having community at the forefront is that we can then inform communities about the things that work when they're putting together policies. And this is going to have a larger impact at the community level because of the uniqueness of these communities, right? So that behind the idea of learning about their capital and how they're using it was like, how can we then support these communities and tell the communities that are not maybe working as well or bouncing back as well, what is working in these communities and what is not, and how can we integrate those networks? And actually, my hopes is that with the analysis that we're doing for food security, that's one of the big aspects, is like what communities did during COVID that help support families experiencing food security issues, what worked with them, so we can help other communities build those systems or infrastructure.
Yeah, thanks for the thought. I was curious. So in the previous iterations of rural families speak, between like families' reactions to monetary policy and health, it sounds like those would have also given insights to the like resilience as a process model that you're studying. So what are you hoping to get out of this iteration that you can't get from the previous data?
Excellent question. Oh, sorry. So the previous studies, there is evidence of resilience, and I showed some of those in the rely on resilience. So what do we hope to learn from this next wave about resilience that we hadn't before? I think because we hadn't specifically asked about resilience, like what does resilience mean for you? There can be many different definitions of what resilience is, and so the only way we'll find that is by asking. And for us not to determine like, okay, this was a hardship and so forth. And the other thing is not just looking at risk and protective factors, which we have done, but really looking at those processes, like how does this unfold over time? And given that we would be doing most likely in terms of resources, a one-time interview, letting folks kind of tell us how things evolved over time. That will give us insight that we didn't have before. That's our hope.
And actually, I want to add that we thought about this, and in this renewal, one that we didn't include this, but one of the objectives was to look at the previous data, to look specifically at resiliency. But that was the year that COVID started, so that part we couldn't really go back the way we were hoping to. There's a group of researchers that still want to look back. They're hoping that they have some. Oh, so yeah, there you are. So they're going. So it was in our plan to look back with this lens, but like, hey, run it. So we're good.